Okay. All right, Ryan. My name's Andrew.
Good to meet you.
Good to meet you. I'm a student physical therapist underneath the direction of Dr. Gravano. So today, I got a kind of on our sheet here. It looks like you're coming in. Your neurologist sent you in because you have a recent diagnosis of Parkinson's. How recent of a diagnosis was this?
I think it was a couple of years ago when I got the diagnosis, but I just started kind of noticing a little bit more that it's been getting worse. So
It's been getting worse.
yeah.
Okay. So in terms of it getting worse, like I guess describing like any difficulties that you're having.
I go on walks with my wife a lot, and I've been noticing she's had to kind of slow down for me. Yeah, and it feels like this left side is kind of like, it just kind of gets slowed up, it seems like. So
Okay. Any pain or any sorts of shooting pains going down the leg at all?
no, not that I've noticed. It's just, yeah, it kind of freezes up when I try to move a little quicker, it seems like. So
Okay.
can't take quite as large steps.
Gotcha. So kind of the main things here is you're slowing down in your speed that you walk at, and then it's just, is it harder at all to like initiate movement at all, or?
I've noticed a little bit of that, like getting in and out of a chair or something. So yeah, I have noticed a little bit of that too.
Okay. And then has your doctor talked to you about using any sort of medication to help?
So yeah, I met with my neurologist. He hasn't put me on any medication yet. He doesn't think I'm quite there.
Okay.
But he wanted me to get into PT. Yeah, because he kind of explained how it's a progressive thing, so you can kind of slow up that progression, and that's good. So
It's perfect.
yeah.
Yeah, that's awesome. Because I think one of the main things with physical therapy is just kind of improving your quality of life. So if we can get you to be able to walk faster and keep up with your wife, better. Like our goal is just going to be to get you stronger, get you moving faster and more confident in the way that you walk and move. Okay. So we've kind of already gone through our history, just getting some good background questions. I'll just fill you in on how the rest of this is going to go. We're going to start by taking kind of a quick screen, checking to make sure your heart's working well, your muscles, your kind of the sensation is doing well. And then we'll move into some more tests and measures so that we get a good baseline of how you're doing today. So we have something to base to see how well you're progressing in the future.
Okay.
And then based on some of the things that we find, we'll see if we can do some exercises at the end there, and then we'll just kind of progress from there, okay?
That works for me.
Awesome. Okay, so we've already kind of talked about most of the symptoms of Parkinson's. So one of the main things with PT is that we can do a really good job of improving your muscle strength and balance. So the more that you kind of take to it, the more you put into it as well, the more you're going to get out of it. Okay, so I just want to make sure that you're taking it seriously because one of the main things that you even brought up was that it is a progressive disease. So the more we do now, the kind of the slower the progression of it. Okay.
Okay. I'm all for that.
Awesome. Okay. And so besides being able to walk with your wife for your normal walks, is there anything else that you'd like to be able to do?
I mean, not really. I know I'm going to be limited for some of the things I do, but yeah, I think just moving quick is really what I want.
Excellent.
Yeah.
Okay. That's awesome. So now we're just going to do a quick check. I'll instruct you through all of these. We're just going to check your sensation and your strength, and then we'll go through just kind of the basic movement screen, okay?
Okay.
So for time's sake, I won't have him remove his shirt, but I'm just going to test the sensation, make sure it's equal on both sides. So Ryan, I'm going to touch the same spot on both sides. I'll have you close your eyes. I want you to tell me if it feels same or different, okay?
Okay. Same. Same.
Thank you.
Same. 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 Same.
All right, and then we're going to move to the legs now.
Okay. Same. 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 The same.
Awesome. Okay, so sensation is intact. Now we'll move to myotomes real quick. So I'm just going to test the major the major muscles of the upper extremity, but I'm going to check all of them in the lower extremity since that's where it seems he is pointing all of his deficits are going to, okay? So Ryan, I'll have you shrug your shoulders up and hold there. And don't let me press down, good. And then I'll have you make a muscle there and hold it, good. Good. And then I'll have you press down, awesome. Hold, and hold, good. So kind of our major muscles in the upper extremity are normal, 5 out of 5. And so next what we'll do is we're going to look at the muscles in your legs, okay?
Okay.
So what I want you to do is kind of reach behind you, grab onto the table, and I'll have you lift your leg up off the table and hold there. Perfect. And then same thing other side. Perfect. And next I'll have you kick your legs straight out. Excellent. And then bend at the knee a little bit. Perfect. And hold. Excellent. Hold. Good. And then I'll have you bring your toes up towards your nose and hold there. Perfect. And then I'll have you point your toes down towards the ground. So a little leap there. Good. And then let's bring those big toes up. Good. Awesome. Okay. So kind of the main things that we got from our myotone screen was that there's a little bit of weakness in the hip flexor, knee extensor, and plantar flexor on the left side. Nothing crazy, but definitely something I want to watch as we're going through our outcome measures and looking at his gait and all those different types of things. All right. So now, Ryan, we're going to just move through a quick movement screen before we get started with those tests that I was talking about, okay?
Okay.
All right, so go ahead and stand up. And then do you feel unsteady at all when you stand there?
No, not really.
No, feel pretty good?
Yeah.
Good, okay. So I have the gait belt on him already. It's just there in case he does feel like he's gonna lose his sense of balance, and I can just correct him quickly. But overall, I wanna see how well he corrects his balance for himself, because that's what our goal here is to get him walking faster and make him feel more confident with his balance. So for this, Ryan, we're just going to kind of look at how well your back is moving, and then check a little bit more into the strength of the legs.
Okay.
And your balance. Okay.
Okay.
All right. So to start, I'll have you go ahead and bend down and touch the toes. Good. And come up. Any pain with that?
No.
Good. And then hands on the hips, and we'll lean back. Excellent. Any pain there?
No, I felt pretty good.
Good. And then let's rotate over one shoulder and the other. Anything there? No? Excellent.
No.
Okay. So going through the screen, we're just making sure that there's nothing else that we need to be concerned with, okay? So I understand that you're coming in with kind of the left-sided weakness and the slow gait speed, but if there's something else we can improve on, let's go ahead and work on it, okay?
Okay.
All right. So the next one I'm going to have you do is I'll have you take a step forward. Perfect. And then you can stop there. And we're just going to go into a little squat.
Okay.
Good. And up. Anything there?
No, I actually felt pretty good. So.
Good. Awesome. And then lastly, we'll check your balance. So I'll have you start on that right foot. Go ahead and lift it up off, or the left foot off the ground. Perfect. Pretty strong there. Looks pretty good.
Felt pretty good on this side.
Good. And then we'll go ahead and work on that left side. And a little bit more shaky.
Just a little. I can do it, but yeah, I feel like I have to kind of correct a little bit more.
Okay. All right. Okay. So next I'll have you go ahead and take a seat onto the table, please. And based off of kind of our movement screen there, everything seems to be within functional limits. Just based off of the squat, he's able to get full knee extension and good extension at the hip. So there's nothing that I would feel that would warrant me going into specific range of motion testing at the knee or at the hip. All right, so Ryan, before we start with our tests here, I'm going to go ahead and take your vitals.
Okay.
So have you had your vitals taken before?
Yeah, every day or every time at the doctor.
Every time at the doctor.
Yeah.
Okay, so normally I would want this to be on the skin and have the stethoscope directly on the skin so I could hear, but I'm not going to have him take his shirt off, and then we'll go ahead and put that on the finger there, and then if you want to, we can wrap that on your hand. We'll just keep that on there.
Okay.
The rest of this. All right. So I'll bring you up here. So arm is at heart level, and then I'm just gonna first my favorite word, obliterate the radial pulse.
It's a tough one.
All right. And then while we're letting that refill, I'll go ahead and look into doing his respiratory rate as well as his heart rate. All right. And then we'll go ahead and take your blood pressure. Let's drop that down for a second. All right, and then we'll bring it back up. And then you just do your best to relax there. All right. So now we've got his blood pressure, heart rate, and respiratory rate all within normal limits right now. He's got a normal blood pressure. Respiratory rate is normal as well. He's breathing through his belly, which is a good sign. And then heart rate again is probably is about 70 beats per minute, which we can use to calculate his target heart rate for his activities. But everything is normal, but we'll use that as a baseline to monitor whether or not the exercises are appropriate or the outcome measures are appropriate. But we'll continue from here. And I guess based on his heart rate and his max heart rate, we can calculate his target heart rate for the 60 to 65% for his age range is 117 to 126 beats per minute, which is what we'll use as I go and monitor him throughout his exercises as well as outcome measures. So Ryan, first off, we'll go ahead and explain our RPE scale, which I have on my phone. Okay. It goes from 6 to 20, 6 being easy, like you're just sitting here right now, and then 20 is the most effort that you've ever done. You can kind of see here in the middle, we have our range from 12 to 14. That's going to be somewhat hard. We just want to make sure you're working well, but not too hard, okay?
Okay.
So as we go through these measures, I'll have you tell me how you're feeling, and then that way we can kind of assess, make sure things are appropriate, okay?
Okay.
All right. So to start, Ryan, I'll have you take a seat in this chair.
All right.
And as long as you're feeling comfortable there.
Yeah.
And then I'll explain our first one is called the cognitive tug. So this one's going to assess how well he does with adding a cognitive task to this test. So for this, what I'll have you do is I'll have you start with your feet flat on the floor, back up against the backrest. You're going to stand up slowly without using your hands. You'll walk around the cone over there and sit down. Okay. But the cognitive task is you're going to count backwards from 75 using the number 3. So you go 75, 72, so on and so forth.
Okay.
Okay? All right. And when you're ready, so the proper thing for this is we'll do one practice round with 2 attempts. The 2 attempts will be averaged for time afterwards. And then I'll talk about how his results bear up. But this is a good indicator of his transfers, being able to change in direction as well as his quality in movement. And we'll be able to tell if he's at a higher falls risk based on the time that he gets on this test. All right, so Ryan, when you're ready, go ahead and start. And I'm going to be walking next to him just to make sure he doesn't feel like he has a loss of balance. All right. So that was our practice run.
Okay.
Next time, let's make sure we count backwards from 75.
Oh,
okay?
sorry, I messed up on that.
No,
Okay.
you're okay.
Thanks for the reminder.
Of course. Let's go ahead and try that again when you're ready.
Okay.
And go.
All right. 75, 72, 69, 66, 63. Oh, that's a lot tougher.
Good.
With the counting.
Yeah, it's a little bit more challenging.
Yeah.
So his time was actually fairly good. It was about 17 seconds. For a normal community dwelling adult with Parkinson's disease, it's going to be 16 and a half seconds or faster. So he's actually doing really well, but we obviously have something to work towards.
Mm-hmm.
I would take his vitals right now, make sure he's having an appropriate response. So I'll go ahead and take your heart rate, which I guess I could look at the pulse ox for, which it does. It is responding appropriately to exercise. And then on the RPE scale, how would you say that ranked?
I think with the counting, it was probably like a 12 or something.
Okay.
No.
That's pretty good.
Yeah.
Okay, so we're getting a good baseline of how well you're doing. So heart rate did really well there. So for our next test, it's another one to just kind of test your falls risk. So I'll have you go ahead and stand up.
Okay.
All right, and then I'll have you go ahead and face away from me.
Okay.
So this is called a pull test. So I don't want to just kind of throw you into this without explaining what it is, but I'll have you stand with your eyes open and feet shoulder width apart. I'm going to be standing behind you, and I will catch you if you lose your balance. So I'm going to give you kind of a pull backwards, but I want you to do whatever you can to stay standing upright, okay?
Okay.
All right. Good. That was really good. So go ahead and take a seat down and I'll explain the results of that. So our score on this one was a 1 because he took between 1 to 3 steps of backward steps but recovered independently. And a score of 1 is actually indicative of a high falls risk within Parkinson's disease. So we could tell that he took some small steps when he was pulled backwards. So this again gives us something to work on, kind of his reactive balance. And we can use this in the future as a quick kind of retest to see how well we're doing with our balance as well as our gait training. All right, and then I won't ask you the RPE, but can you kind of describe how you felt during that test?
Yeah, it just kind of caught me off guard. I mean, I knew what you were going to do. You explained it well, but I guess reacting that quickly was a little harder than I thought it would be, but.
Okay.
Yeah.
All right. Overall, though, you didn't feel like you were going to fall?
No, but, I certainly didn't feel steady.
Okay. All right. So definitely gives us some more stuff to work towards. So now what we're going to work on or look into is doing a quick agility course for you. I have some exercises in mind that I think will help with your gait speed and your balance. So I'll kind of demonstrate each one, and then we'll go through each, just kind of get a good bearing for how long you can go before getting tired, get to that RPE level of between 12 and 14.
Okay.
And then we'll set some dosage, which is just kind of how long you'll go through it for the circuit, okay?
Okay.
All right. So for our first exercise, we're going to do some marching with high knees. So I'll have him march and tap his knee into his hand as he's marching. And I set up a course of about 10 feet, and he'll go back and forth. And then the next one are lateral shuffles. So he'll stand up tall, move to the side, and back again in our 10 feet little zone. We're going to work on some lunging. So he'll lunge forward and then spring himself up, working on it, some explosiveness and some quick movements, which is pretty important for Parkinson's disease, is getting some of that quick reaction and quick initiation of movement back. And then lastly is our squat with an explosive press up. So he'll squat down and then kind of stand up and bring his arms up and overhead. All right, so Ryan, I'll have you go ahead and stand up. Good. You feeling okay so far?
Yeah.
Good.
Yeah, I think I feel okay.
Good. So we'll go through these exercises. I'll ask you the RPE scale with each one, and I'll measure your heart rate just to make sure you're feeling okay.
Okay.
But we'll just kind of go for time and see how well you do, okay?
Okay.
All right, so our first one are going to be our marching while tapping your knees into your hands, and I'll time you.
So want me to start?
Go ahead and start. Good. And I'll be nearby just in case he does feel like he's going to lose his balance.
Yeah, it feels a little stiffer on that left side, but...
Okay. But you don't feel like you're going to fall at all?
No, I don't feel like I'm going to fall.
Good. All right. And that's about 25 seconds. How are we feeling?
I feel pretty good. I'd say probably like a 12 on that, yeah.
Okay. So we'll go ahead and stop. So 25 seconds is good for those high knees. And then we'll work on our lateral shuffling. So we'll go ahead and start on one side here, Ryan. And then we'll work into some, normally I would check his heart rate, make sure he's responding appropriately. It is, so I'll take a quick check. So heart rate is within, if not below our range right now. So he is of good cardiovascular endurance. So in a normal patient, we'll make sure that they're staying within that target heart range and not going over, but not going below, so that we're dosing appropriately. So our next one, Ryan, is going to be those lateral steps. So I'll just stand in front of you and kind of guard you, make sure you don't fall, but you're going to go ahead and just kind of shuffle from side to side, okay?
Okay.
So go ahead and go when you're ready. All right, and we're kind of nearing that same time of 25 seconds, Ryan. How are we feeling?
These ones feel a little easier. I'd say I'm about 11.
About an 11? Okay.
Yeah.
So we'll probably add some 1 pound ankle weights just to make this more challenging, get him up to that RPE level. But we'll go ahead and check vitals on pulse ox, which again is responding appropriately to exercise. And then our next one are going to be our lunges. So we'll alternate legs. I'll have you go ahead and lunge forward and then press yourself back up. Okay? So as far as you can without losing your balance. And then quick. Good. And then other foot. And up. Good. Down and up. Perfect. And up. Good. And now again, kind of nearing that 30-second mark. How are we feeling?
These ones I'd say are maybe a 14.
A 14?
So
okay.
It was a little harder, but it feels good.
Good. Okay. So I think that's working pretty well. If we wanted to make it a little bit easier, and I'll go into the progression regression again at the end, we can just give him some more break time in between alternating. All right, Ryan, and lastly, we're going to do our squat with our punch-ups, okay?
All right.
So when you're ready, go ahead and squat down and punch up nice and quick. Good. And back down. Awesome.
Can I make the noise with it?
Of course. You're like Superman. All right. And how are we feeling here on our RPE scale?
I'd say about 13, yeah.
13?
Yeah.
Good. Okay. And then I'll check your heart rate. It's responding appropriately, actually a little bit higher than before, so which is a good sign. So we're getting some good cardiovascular activation with this. All right. And then, so you can go ahead and sit down, and I'm going to do some talking to the camera now. But essentially, so we're monitoring his vitals throughout. I felt pretty comfortable since his blood pressure in the beginning was at a normal range, just to assess heart rate throughout and use RPE to make sure we're at a good level, make sure we're not going into anything dangerous. And then progressions for this and regressions are pretty easy. You can increase the time per circuit or decrease the time per circuit. And then kind of like I talked about, a lot of these are lower extremity exercises, so you can also add ankle weights, or you could even move to a pool if it's too difficult and kind of offload them. But one of the main things with Parkinson's is we want some quicker speed and larger movements. So working on land and working to kind of get them out of their comfort range is going to be very appropriate to get them to feel safer with their balance as well as initiating movement. All right. And with our outcome measures, again, these will give us good test and retest measures. Make sure that we're progressing appropriately if not maintaining the same level, since Parkinson's is a chronic and progressive disease. So our PT diagnosis for Ryan here is unilateral stiffness and some weakness in his left lower extremity, especially with knee extension and hip flexion, but these will be worked on with our interventions. So some pretty mild bradykinesia, which is the slowness of movement. And then, Ryan, one of the main things that we can do for you is, along with kind of this exercise circuit that I've outlined for you, doing it 30 seconds, we can do that up to 3 times, especially if you're feeling like there's someone around, like your wife, who's able to support you if you do feel like you're going to fall.
Okay.
And then keep up with your walks, just work on taking some bigger steps. You can even use something like a metronome where you're playing like a beat, or have some music that has a good beat to it and try to walk to that beat. Okay. And then any questions on your part for me?
No.
No? Okay, I thought you did a great job. Thanks for coming in.
All right, thank you.